name is Heather Suri, and I own an aging life care management practice called Pathways in Aging here in Northern Virginia. We also serve the greater Seattle area. We've been in practice 8 years now and have a group practice. We serve older adults and their families, whether that's family of origin or family of choice. We serve as professional advocates, as expert medical care coordinators. We help folks build teams and intervene in times of crisis, and probably most importantly, plan for the future. Okay, so let's talk about hospice and palliative care and what's similar and what's different. First, I want to say that palliative care is an approach to care. It's an approach where we put the individual's comfort and quality of life in the center focus of every decision that is made. If you think about palliative care as an umbrella, hospice is a service that comes under palliative care. Now that can get confusing because a lot of people know about people who receive palliative care services that Medicare covers and that involves someone coming to your home. So if we talk about hospice as a service and palliative care as a service, they are both covered by Medicare. Folks who are electing hospice services generally need to have a life-limiting illness with a prognosis of 6 months or less. So that's something that the physician certifies. And when someone is under hospice care, we're no longer pursuing curative or rehabilitative treatment. Our sole focus under hospice care is comfort. Through the Medicare hospice benefit, we get nurses coming to visit, we might get a home health aide coming to visit, a chaplain, a social worker. There's a whole interdisciplinary team that provides intermittent visits. And this is a critical piece of information that a lot of families miss, is that these visits are intermittent. Hospice does not provide care that comes to the bedside to help care for someone for 4, 6, 12, 24 hours. That is still a service that is performed by a home care agency. So for people who need that kind of care going on to hospice, you hang on to your excellent home care company, and hospice is an additional service that comes on top. Now, for people who maybe aren't quite ready for hospice, they don't meet that eligibility criteria, they're not in the last 6 months of life, or maybe they still want to benefit from rehabilitative services like rehabilitative physical therapy or occupational therapy, or they might still be pursuing some treatments for their illness, but have symptoms of discomfort that are disruptive to their lives. Palliative care can be a great solution for that. So a palliative care provider might be a doctor, might be a nurse practitioner, would typically come visit about once a month to address the symptoms and give some ideas, might include prescriptions to help manage symptoms of discomfort. Could be pain, could be shortness of breath, could even in some cases be agitation or anxiety. So they can be a great supplemental service, does not replace your primary care provider, certainly doesn't replace your home care company, but can provide some additional support around symptoms of discomfort. Okay, so Safe and Secure Transitions is one of the home care companies that we refer to most often because of the quality of the work. You know, it's the level of communication that we get from the caregivers is something that families and care managers value greatly. If we don't know what's happening, it's hard for us to make impactful recommendations. And so when you have a home care team that is the boots on the ground, the eyes and the ears that can keep that communication flowing back and forth, it actually saves families money from a care management standpoint, because we're not chasing the information or trying things that aren't going to work, because we've got this really detailed, high quality information and communication coming. And I think that they hire very selectively. The caliber of the caregivers that we see working with Safe and Secure is impressive. And as I mentioned previously, that oversight piece is there. I think the caregivers, in my experience, feel very supported. They know that the office has their back. They know that the office believes in them. They know the office is respectful of their professional talents and treats them like the professionals they are. And so all of that together makes for a really elevated experience that is certainly different than the run-of-the-mill.